that comment about colleges moving into like a 3 application cut-off rule, I thought that was really interesting. If I interpret it correctly, you're saying the impetus behind it was more so that colleges are now taking people kind of PGY 5, 6, 7, and maybe that was a way to ameliorate it. This might speak to me as someone who's a bit more risk averse, but I would have thought that would have the opposite effect, where people would be very trepidatious and trying to cap out everything before they submit their first one.
Yeah. So I was being pretty superficial about explaining that, but there are multiple reasons. One reason is that we're not saying to the applicants, look, you've bombed out for the 4th time or the 5th time, you really need to start thinking about an alternative career pathway. So that's one factor. But another important factor is that we, as a college, we looked at our data and we worked out that if you have 3 or more unsuccessful applications to surgery, but you then finally get in, that cohort of trainees actually perform less well during training and in the final exam, okay? So there is some data to support that, and the AMC's asked us to go and look at that, and that's what we found. So there is a predictive value. The number of times that you unsuccessfully apply, does have a correlation to how well you perform in surgical training. But of course, there are multiple factors that might determine how well you perform in training or why you didn't get into surgical training. And one of the other factors is the number of positions that are available. So that might apply in orthopaedics and general surgery and to some extent urology, where there's a lot of, and plastics, they have reasonable numbers of positions available. But if you look at the smaller specialties like paediatric surgery, cardiothoracic surgery, neurosurgery, they only have 4 or 5 positions in the whole of Australia and New Zealand each year. So they would not put a cap on the number of applications, okay? Yeah. But you're right, it's open to gaming and it's open to adverse, unwanted effects like, well, I think I'm ready now, but maybe I should just finish off and do a couple more presentations, boost up my CV, and then apply. And that gaming will always occur, okay? It will always occur. And I haven't sort of talked too much about all the components of applying for surgery. There's CVs and presentations and, whether you lead a journal club or whatever, some sort of management leadership skills and all of that. But part of my point tonight was to emphasise that you can do all of those things, but do not let that be at the detriment of being a good clinical doctor, because ultimately that's what we're looking for, that you need to be effective and sound and really excellent as a clinician.